let us start discussion on especially the social entrepreneurship, disruptive solutions via innovation and tech for good. So it's a very new subject, but again emerging subject which is progressing day by day. The way this CSR Act has been, in fact, you can say CSR Act was not there, but people were doing CSR. After 2014, it became, in fact, mandatory. Slowly, people were thinking that okay, CS, a lot of NGOs will get lot of fund, but still many NGOs are struggling. So this is uh, this is this is the actual situation that the way we were thinking that okay, now it's a boom for NGOs that they will get proper funding, but there's still one few NGOs who are able to get proper funding. It means there are something which is missing in between. So and solutions are also here. And what is the solution? So I think the social entrepreneurship is the only solution, because so I was discussing with few attendees outside this hall. So so there was a discussion that why NGOs are not able to get funding, because we are able to implement projects. So NGOs are coming for the need of fund. They are not. If NGOs are here to for the need of fund, certainly there will be no sustainability of any that project, because they will just implement the project and they will go out. But if any NGO or any enterprise or any social enterprise who is there to create impact, certainly many fund will come to him or her, and many organizations will also come to support their mission. So if it is required now that NGOs or social entrepreneurs should work towards identifying a mission and then work on that mission. Certainly many people will come there. Even CSR will come, HNIs will come, many individual donor will also come to support that mission. And I think that will be the sustainable way of doing impactful work in the society. So that's why this new concept of this social impact fund, and then again social stock exchange has been created, and now government is also thinking that good organizations who are having a structured program, they should be in panel on that, and many corporates should support that. So it's growing. So certainly this is one part, but we will discuss more on this, because we have very good experienced panelists. So let us start with first. You just introduce yourself, and then we will discuss more on this subject, that is social entrepreneurship, disruptive solutions via innovation and tech.
You're looking at me, so I'm assuming you'll start with me, Mr. Prakash. Thank you, everyone. Thank you to SICA, the CSRUniverse, and Be Vocal to have us here. My name is Pratima Harite. I head Asia Pacific Corporate Citizenship. I look at CSR and philanthropy within Lenovo for 13 markets. India is one of the most important markets for us in the geography where we belong. Our brand promise or our vision statement is smarter technology for all. And within that, when it comes to philanthropy and CSR, it's access to technology for the underserved and STEM education. So a large part of our portfolio focuses around STEM education in the schooling ecosystem, as well as in the youth. Having said that, there are Tech for Good campaigns that we have created that help build the ecosystem of social entrepreneurship. Thank you.
Thank you so much. I'll go next. First of all, I'd like to thank SICA and CSRUniverse for setting up this platform to showcase the convergence between entrepreneurship and CSR. I think this is definitely need of the hour. I'll first introduce myself and my organization, BrainsightAI. We are a Bangalore-based neurotech company. We are developing solutions for better treatment, diagnosis, and prognosis of neurological and psychiatric disorders. Just to give a bit of context, neurological psychiatric disorders are one of the largest burden of disease globally. As per a very recent Lancet report, over 3.4 billion people across the world suffer from some kind of neurological psychiatric disorder. Within India, if I talk about serious disorders including brain tumor, epilepsy, stroke, we have over 1 crore almost 1 crore instances of traumatic brain injuries or stroke instances across the country in a single year. Over 1 crore patients currently living with dementia, schizophrenia, and other neurodegenerative disorders, and many more living with epilepsy since childhood, as well as in other older ages. So this is the cohort that we want to address, improve their diagnosis, their prognosis, and essentially the quality of life, because that is not just the mortality, but the quality of life that such patients enjoy after encountering any such incidents. It gets severely impacted. Their ability to communicate with their family members, to continue with their professions, gets severely impacted, and we want to bring our little bit towards minimizing that by improving the quality of care that they enjoy right now. So that is our mission statement, and with support from the CSR Universe and other players in the ecosystem, I think we can bring this solution across to many more people. So very happy to be here, and I'll pass it along to my fellow panel members.
Yeah, thank you so much. Myself, Kishor, I'm a co-founder of Buddy4 Study, and we are Noida-based basically, and we started Buddy4 Study a decade ago with an intention to provide scholarship awareness in the society, because we feel that there are a lot of scholarships available, but no one know about that. And starting when we were started, just keep lots of newspaper are filled with the scholarship, but people are not actually know about them. Also, they are not able to apply with this. So this this idea started from there, and we thought that there should be awareness at least, and we started this Buddy4 Study, and we started all the work around it, and then we start application. After that, and whole idea works like a charm, and lots of people encourage us. Okay, this is a very good idea, and we after that build a platform called buddy4street.com, and now we have a lots of almost the 20,000 followers over there, and this idea is started with simple, that we spread the awareness, but now it becomes so big, and people are encouraging us, and I have seen a lots of potential over there. Now students are coming to us that we want scholarship, we are underserved, we have so many these financial issues, and after that we know that there are these lots of CSR programs are going on, and we are implementation agency. After that, we became implementation agency, and we started collaborating with them, and now we have almost 80 plus partners who are working with us, and we are serving the students community very well, and I think it's a great idea, and it's going to be a big thing in the coming days. Thank you.
Thank you so much. Glad to be here. Good afternoon, everybody. I'm Pranav Gupta, and I'm a global head of partnerships and commercials at Wysa. So Wysa has a very interesting story, actually. We are an India-based company that has become a global leader in AI-based mental health solutions. We've also, in the last 2 years, the change that has happened is that ACT grant, they came to us and they said that, can you build the platform in Hindi? Like, we were primarily only in English up until then. And now we are creating a lot of impact for Bharat. We are building for Bharat also. So we already are in 95 different countries. We have 11 million lives that we have covered. But our goal and our mission and vision is to reach to 50 million people by 2035. And a large percentage of that has to come from India. So we are doing a lot of that work now. Our tagline for what we do in Wysa for Hindi, we say it's Man ka coach, jo badle soch. Right? So that's the kind of work we want to do. I'll be happy to share more insights as we speak. Thank you. Thank you, Pranav. So now I think we should discuss more on nuances of this sector. So I will come first to you. So you are into digital mission. So where So certainly, not in the urban area, tier 1, tier 2 cities, you will find that now people are having access due to mobile technology also. Now in the rural area also, uh, there are access. During COVID also, we seen that in the rural area also one phone was giving, in fact, knowledge to many kids in one family. So, so how do you see the role of social entrepreneurs who can bridge this gap, take support from you, and how you are utilizing such social entrepreneurs who can bridge this gap, so that, especially this, as he told that we should work for Bharat, so how we can make that Bharat accessible to this technology.
I'll just take an example, share an example with you. Lenovo works on a program known as Endangered Indigenous Languages, which is under the aegis of UNESCO. Why are we working on endangered indigenous languages? In the last 1 decade, there have been 1,000 plus languages that are going to be wiped out from the world because you're not going to have enough speakers. Those languages don't have scripts. Therefore, you're going to lose out a lot of the culture and the value that these languages have, and there is no repository of it anywhere. Westernization, migration, children not wanting, younger generation not wanting to pick up the older languages is where the endangerment comes. And therefore, we tied up with UNESCO where we said that we would pick up 2 languages in India, which we would unicode on the Motorola phones. Motorola is a group company of Lenovo that produces mobile phones. Why would we want to do that? Because we want to give our customers and our clients who happen to be inhabitants of this country to be able to speak in their language. If the language is dying, then you must imagine that there are senior citizens who are not going to be able to talk to their younger generation when the younger generation is not in the place of stay where they are in. Therefore, we tied up with UNESCO to say that when we create the Unicode, we would also put it up as a white paper for anyone to adopt. That's how we see the potential of access to technology. You pick up things that you know are going to be a problem or a statement where you know that there is going to be a challenge. You pick an opportunity out of that and you create that access. That's just one example, but I can go on and I will hold on to give the other people an opportunity to speak.
Sure. So, Prakhar, you are working on neuroscience. It's a new thing. So, general people, even I can't say that we know more about this. And you are developing uh, lot of software and then supporting the professionals in this sector. But again, if coming to the new technology and then convincing the professionals who are using this technology, so either the community or industry, so they are reluctant to use new innovative technology. And again, there is another challenge of scaling. So how to scale those innovation and technology. So what is your suggestion, and how any such entrepreneur should act on this to spread awareness, so that people will get more impacted, so it will create more impact in the society. So what is your suggestion on this, and how you are meeting with those challenges?
Thank you so much for your question, sir. And I think you've hit the nail on the head. Uh, Unfortunately or unfortunately, with any technological innovation, especially with deep tech innovation, there is a fairly long gestation cycle before the technology is able to convert into a viable product, and then that product is able to actually reach the masses for which it is intended. Especially with a product like ours, which is at the intersection of machine learning and artificial intelligence, medical imaging, as well as neuroscience, that journey becomes even more complex. However, that is our responsibility as entrepreneurs to facilitate that journey and to make these topics more accessible for both the specialists and the general audience. And that is the approach that we've also taken. So the first challenge that any entrepreneurial journey encounters is, how do I make this relevant to the users? what we in entrepreneurial language like to call the product market fit. So for us, in that respect was, how do we use advanced machine learning, AI-based algorithms that are working on medical imaging, MRI-based imaging? How do we make it accessible to the neurosurgeons, to the neurologists, to the psychiatrists who will be using it for treating patients? And this is again a journey. A neurosurgeon doesn't know what an AI algorithm is. So he needs to have that absolute trust on the system to be able to, one, first interpret it, and then to be able to use it for every case without having to question himself back and forth. Fortunately for us as entrepreneurs, we were able to speed track that journey very, very much, working very fast, very quickly, very iteratively with some of the best hospitals, some of the best doctors in India. And we would like to believe that to some extent we've made that technology already accessible. We work with over 20 hospital chains, major hospital chains across India. Our product has been used by those neurosurgeons for over 600 neurosurgeries to improve the outcomes for the surgeries. So to some extent, we've already covered part of the journey. The second step is even more crucial, and that is where I believe the CSR ecosystem really needs to converge with the entrepreneurship ecosystem. That how do we go from 20 hospitals to 2,000 hospitals? How do we bring it from being used by select multi-specialty hospitals, senior neurosurgeons, to it becoming a standard part of your quality of care, of your care protocol across the country? We try to work with hospitals, with partners who are working with segments you would, at this stage, for example, not be able to afford it. For example, we're working with St. John's Institute in Bangalore, which is a trust hospital, working with patients from low-income segments. Can we work with the CSR and the philanthropic ecosystem to work with more such hospitals, to bridge that funding gap that makes it possible? So I understand that, for example, a CSR would be very reluctant to invest in technology when it is still before a PMF stage, because there is a lot of inherent risk. There is a lot of uncertainty whether patients will actually get the benefit of this or not. But now that that uncertainty has to a large extent been covered, the impact is very clear that, okay, if a hospital in Bhopal gets access to this, then the hospital which is catering to patients from across the state would be able to improve the quality of care for so many more people. So can philanthropic organizations, CSR funds, help us bridge that gap? And that is where we want to go next, work more and more with them and increase access to more and more people possible. We just don't want to work with a few select group of people who are able to afford expensive therapies and treatments. We want to make it accessible to more and more people within India. The fact that we're based in India makes it easy for us to make these technologies affordable to people. For example, an equivalent competitor to us, which is based out of Australia, would be charging thousands of dollars for this technology. We are able to inherently bring that price much lower, but the gap still remains. How can we work together to bridge that gap? That is the vision that we want to steer towards.
Thank you. I think with the support of CSR, your organization can reach out to many such tier 2, tier 3 cities. And
absolutely.
Those hospitals, especially if we can reach out to government hospital, it will be better, because still the larger population of this country is dependent on government health system.
Absolutely.
If through the help of such CSR funding or HNI funding or any donor, if they can support such initiatives, certainly we can help more and more patients who are having neurological issues. So thank you. Next, body for study. In fact, your organization is aspiring many people in this country, especially who are underserved, who belongs to underserved community. So because this was the need, so one organization like madam was telling that, so how they are reaching out to many people. So same way your organization has created a platform just like a marketplace where donors who wanted to support some child, but at the same time the children or students who need support, they also required a platform from where they can access all the scholarships which are available for them. So you created that marketplace. And so how tech has helped you, and how tech is going to help in the next 5 to 10 years to such students who can further get advantage of such scholarships or such support, which can help them to to access such scholarship and then grow in their career.
यस, एक्चुअली जब हमने स्टार्ट किया था तो ये तो हम उस टाइम भी देख रहे थे कि मार्केट में बहुत सारे लोग सीएसआर पे स्कॉलरशिप पे काम कर रहे हैं, बट उन सबको देख के, क्योंकि आप लर्न करते हो कि आपके आसपास क्या हो रहा है, तो ये हमें कंफर्म हो गए थे कि विदाउट टेक हम इतना ज़्यादा ग्रो नहीं कर पाएंगे, क्योंकि टेक तो आपको रखना ही पड़ेगा। विदाउट टेक सॉल्यूशंस आप कितना भी अच्छा काम कर रहे हो, बट वो इतना स्केलेबल हो ही नहीं सकता। तो हमने डे वन से था कि हमको तो टेक में ही अपना प्लेटफॉर्म बनाना है, तो हमने वो स्टार्ट किया। और स्टार्टिंग में सिर्फ अवेयरनेस से स्टार्ट किया, बाद में अपने उस टेक प्रोडक्ट को हमने इतना एनेबल्ड कर दिया कि नाउ आफ्टर दैट कि हम कोई भी स्टूडेंट्स आके किसी भी स्कॉलरशिप को सर्च कर सकते हैं। वहाँ पे बहुत सारी गवर्नमेंट की, नॉन गवर्नमेंट, एनजीओ, प्राइवेट, बहुत सारी स्कॉलरशिप्स को हमने स्टार्ट किया हुआ है। कोई भी स्टूडेंट जिसको चाहिए वो आके आके वहाँ पे उसमें देख सकता है। आफ्टर दैट वी रियलाइज कि यहाँ पे एप्लीकेशन का बहुत बड़ा इशू है। एप्लीकेशन जब भी कोई स्टूडेंट किसी भी प्लेटफॉर्म पे भरने उस टाइम पे जा रहा था, आज से 5-6 साल पहले की बात कर रहा हूँ मैं, तो बहुत काफ़ी सारे इश्यूज थे, क्योंकि टेक्नोलॉजी किसी भी सोशल इंटरप्रेन्योर या कोई सीएसआर एजेंसी के लिए बहुत मुश्किल काम है, क्योंकि वो कॉस्टली है। आपको हर 2-3 साल में प्लेटफॉर्म अपग्रेड करना पड़ता है, और वहाँ पे आपको पूरा टीम रखना पड़ेगा अपनी टेक्नोलॉजी के लिए। तो ये बहुत ही मतलब पेनफुल टास्क है। तो वी रियलाइज़ कि नहीं, ये भी हमें करना चाहिए, क्योंकि आप साथ में काम कर रहे हो तो सीखते हो। तो हमने वो भी इनोवेशन लेकिन ये स्टार्ट करते हैं। उसके बाद हमने अपना खुद का एप्लीकेशन प्लेटफॉर्म बनाया, और हमें पता था कि ये अगर नहीं होगा तो हम आगे ग्रो नहीं करते। हमने फिर से एप्लीकेशन रिसीव करना स्टार्ट किया। वी स्टार्टेड शॉर्ट लिस्टिंग। आफ्टर दैट वी स्टार्टेड कि नहीं, अब जो स्कॉलर जो डोनर है उनको पूरा शॉर्ट लिस्ट करके देना है। आफ्टर द शॉर्ट लिस्ट वी स्टार्टेड ट्रैकिंग ऑल्सो, कि एक स्टूडेंट मान लिया उसको स्कॉलरशिप मिल भी गई, तो वो 1 साल तक क्या कर रहा है, अगले साल क्या कर रहा है, क्या उसने जॉब स्टार्ट हुई, क्या जॉब स्टार्ट अगर नहीं हुई तो वो स्किल का प्रॉब्लम है। अब स्किल का प्रॉब्लम है तो देन वी अगेन थिंक कि नहीं यार, ये तो सॉल्व करना पड़ेगा। इसके लिए क्या करें, मेंटरशिप स्टार्ट करते हैं। तो जैसे जैसे प्रॉब्लम आता गया वैसे वैसे हमने टेक सॉल्यूशन स्टार्ट किया। आज के टाइम में हम लोग मेंटरशिप भी स्टार्ट कर दिए। मेंटरशिप में, क्योंकि इसको जॉब अगर नहीं मिला, स्कॉलरशिप मिलने के बाद उसको अगर लास्ट में जॉब नहीं मिला है, तो स्किल का इशू को भी हम लोग सॉल्व कर रहे हैं। तो हमको फाइनली यह इंटेंशन हमारा स्टार्टिंग से ही प्योर था, क्योंकि कोई भी आप इंटरप्रेन्योरशिप स्टार्ट करते हो तो वहाँ पे एक एंगल होता है कि अगर आप इंटेंशंस प्योर है तो आप सोशल इंटरप्रेन्योर हो। अगर वो आपका प्योर नहीं है, आपको एक तरीके से किसी और वे में देखना, पैसा के जो पीछे जाना है या क्या करना है, वो फिर इंटरप्रेन्योरशिप है, वो सोशल इंटरप्रेन्योरशिप नहीं है। तो कहीं ना कहीं वो इंटेंशंस हमारा बिल्कुल क्लियर है। और आज भी हम लोग ये है कि हमें दोनों तरफ से बिल्ड करना है अपना जो कॉन्फिडेंस है, वो जो ट्रस्ट है, स्टूडेंट की से भी हमें ट्रस्ट बिल्ड करना है, और जो डोनर है उससे भी ट्रस्ट बिल्ड करना है। तो कहीं ना कहीं हम एक 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 ब्रिज है बीच में जो ट्रस्ट पे काम कर रहा है। और टेक इसका कोर है, हमारे डीएनए में ही पूरा टेक है। क्योंकि टेक के बिना हमारे पर ना तो ट्रांसपेरेंसी आएगी, क्योंकि ट्रांसपेरेंसी बहुत इंपॉर्टेंट है। स्केलेबिलिटी बिल्कुल नहीं होगी टेक के बिना, वो भी बहुत इंपॉर्टेंट है। और एफिशिएंसी हमारे लिए इंपॉर्टेंट है कि हम मोर देन 80 प्रोजेक्ट्स एक साथ हैंडल कर रहे हैं आज के टाइम में। तो कहीं ना कहीं वो जो टेक है वो हमें ही हेल्प कर रहा है। और आगे फ्यूचर हमारा बहुत ब्राइट है, क्योंकि आगे हम लोग एआई पे काम करने का स्टार्ट कर दिए। कहीं ना कहीं ये एआई जो है वो ऑटोमेशन में हमें हेल्प करेगा, ट्रस्ट बिल्ड करेगा, और स्केलेबिलिटी तो है ही। तो आई थिंक ऑल थिंग इज अराउंड द टेक नाउ, एंड इट इज़ वेरी इंपॉर्टेंट फॉर अस एंड the society also. Thank you.
Thank you. Thank you. So it
We-
means tech is.
I'm sorry, just we have 5 more minutes left.
Yeah.
Really sorry to
So
interrupt you.
tech is not only helping to the student, but it is helping to the donor also to measure the impact. So how things are progressing. It's a very good help to the entire ecosystem. Now coming to Pranav. Uh, so you are so we have seen the cases of mental health after COVID. So it is increasing, and again the awareness around it has also increased. So can you help us to understand what is your model and how you are helping community to come out from this situation?
Sure, sir. So when we think of the model for Wysa, it's around one, early intervention, right, and prevention. Because the problem with mental health is if it becomes like a real challenge, and then you have to go to a doctor or you have to take medication, then also the impact on the individual is high, but also that you will spend a lot more money to treat it, right? It's too late. End of spectrum care, that's mostly deployed. So we want to do that early. Now, if you think about the model, like let me let me tell you about how do we look at tech as an enabler, right? If you think about of three A's of mental health, so availability, accessibility, and affordability. Now, for availability, because Wysa is available on app and through a platform, it's real time, like it's available 100% of the time. Now, like you said, what has happened in the last few years is that smartphone penetration is great even in rural India today. Geo has also brought in internet, right? Now, these two things, which were the determinators for us, have been taken care of. Now, everybody who has a phone has access. Availability is determined by that. The second big thing is accessibility, right? And for us to bring it in a new language, like a regional language, was important. So we started with Hindi. We are also building it in Marathi. With Gen AI capability, we are also able to translate it into many languages now, much more easily, right? So access is we are also 100% anonymous, by the way. The app is 100% anonymous, which breaks stigma. So stigma has always been a big problem in mental health, and specifically in our country. So we're trying to break that. We're also looking at psychoeducation, so awareness building, like you said, mental health literacy. So the version of our product that's available in Hindi has also videos on psychoeducation. It's not because people don't understand mental health; they don't have the language to talk about it. People probably understand tanav, right? So that's what we're saying. So today we were coining a term called it should be Tanav Mukt Bharat, right? We have so much Tanav, everybody, right? And that's the thing. So, and then third is affordability. So affordability is about, and again, like it's an India-born solution, so we can do it in a few hundred rupees, and it's again a fraction of the cost of even what end of care services like therapy, etc. is, right? Digital is also cheaper, so we're able to do that. Now we are with the accessibility now that we are able to go into many different communities. So there's intersectionality with livelihoods, also skilling, livelihood, gender, and employability, right? So we have given Vysa to gig economy workers like Zomato, right? So we are actually helping them, deal with their mental health issues, and they do have a lot, right? The second is we are also giving it to blue collar workforce now, smart staff. We're giving it to women in rural Rajasthan via Rajasthan Royal Foundation. Um, and again, it's very interesting because now these women are motivating their young children, girls, to take it up. They're talking about because they're able to share, their concerns around sexual reproductive health, menstrual health, all of this on the chatbot, and it's completely private, that conversation, without any judgment. So those are the kind of use cases that we are seeing, and regional colleges with students, and that's the right age, right, when they develop mental health issues and challenges. So that's the kind of work that we are doing, and the product is already proven at scale. We have done a lot of research globally. Now the idea is that can we adopt it and give it to more institutions and people. The end user doesn't really have to pay for it, right? It can be done by their employer, it can be done by a funder, so on and so forth. So the end user can get it for free, right? So that's what we want to continue doing.
Thank you. So I think now there is constraint of time, but again, so
I just
Yeah,
want to close the loop. So we talked about technology and all the AI, and I just want to take this opportunity that last year when we started talking about emerging technologies such as AI, and I'm not from the tech industry. I mean, I represent the sector, but I'm not from that industry. So for me, generative AI and AI was like mind-boggling, and I looked at my partners and I said, if I'm feeling the challenge in the corporate world, what are you feeling about it? right? And therefore, our global philanthropy team came up with this solution. We created a survey. We wanted to check, what does the social sector think about these emerging technologies? Are they ready to take a look at the technology and adapt it? And if they had to adapt it, how would they be adapting it? So the survey actually talked about the challenges and the opportunities that are available. And from there rose an initiative that we are running today called AI for Social Impact. These are webinars that we've created with Lenovo subject matter experts that talk about AI. It's all there in the on YouTube as well as on our Lenovo owned channel site, which is known as news.lenovo.com. We've had different partners come and talk about it. And while I sounded pessimistic at the beginning, we also had partners of our own who had already adopted AI, and we were not aware of it. So there is a spectrum at one end where there are organizations who don't know where to tap into the resources, and then there are organizations who have gone ahead and done a lot about it. So look out for AI for Social Impact. That's one, the webinars. There will be another one coming up in October that will talk about security and privacy. There's also a grant that will be coming up. There's an organization called Tech to the Rescue. It's an organization that's based in EMEA that provides pro bono technology services to organizations that have a problem statement around technology. They have a program called AI for Changemakers that is supported by Google and AWS. We are looking for, we are actually supporting a cohort of 6 organizations that are working in climate change around biodiversity and conservation, and 4 organizations that are working around education. The climate change cohort is already done, but look out for the education cohort announcement that will come up. It will probably come up in October or November. It's a 2-year program, requires dedicated work from your end because you would have your CTO, CIO, CISO, Chief Information Security Officer, if in case you didn't know that. So they would all be involved, and you'd be able to bring a solution to the table. I'm done. 1 minute.
Thank you so much.
So it's over now, but I think now there are a lot of things happening in the tech sector also. So where people like these organizations, they are coming up with a tool, with a software or with a hardware, which can create more and more impact. And I think this is the growing future of this social sector, where more and more such entrepreneurs will come and with the idea which can create more impact. So thank you.
Thank you so much. I really wish we had more time. What fascinating discussion over here. Mental health for gig workers, indigenous languages.
I think we should give time for question and answer if people are having questions.
Yeah, of course. If anybody has a question, we definitely would like to take at least one question.
I don't have any question, but thank you very much to all of the segment and industry in CSR. I am just reaching to you to listen only here and there, and I am finding that mobility solution in the CSR is being promoted by you people on behalf of Post Motors. Thank you very much for all of you utilizing my vehicles. I am handling the specialized vehicles in Post Motors, being a CFT lead and the CSR solution experience. Thank you.
Thank you very much. If you would just wait at the dais for a moment while we felicitate you.